Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a May 6, 2021 update from the Dubuque County Public Health Incident Management Team. Dubuque County's COVID-19 new case trend line continues downward with 47 cases reported in the last 7 days. Dubuque County has improved to an orange zone, meaning substantial community transmission, as reported in the latest community profile report from the White House COVID-19 team. This is an improvement from where we were for several months, in the red zone or high community transmission category. The majority of Dubuque County cases continue to be in the 19 to 24-year-old age group, and nationally, the current 7-day moving average of daily new cases decreased over 16% compared with the previous 7-day moving average, which was at just over 62,000. Compared with the highest peak on January 8, 2021, which was 249,669, the current 7-day average has decreased 79% from that. A report by the CDC, the COVID-19 pandemic continues to break daily records, even as the global vaccination pace accelerates. Additionally, multiple variants of the virus that causes COVID-19 are circulating globally and within the United States. In fact, this week, Iowa reported 2 cases of the COVID-19 variant B.1.617, which was first detected in Iowa. B.1.617 is not a variant of concern, but it does impact the travel restrictions to India. Along with that, on April 19th, the CDC issued a travel advisory update, resulting in a significant increase in the number of countries classified as level 4, do not travel. This increase meant that about 80% of the countries worldwide have that do not travel designation. So with summer approaching and everybody wanting to travel more than ever, take the time to plan ahead and check travel restrictions and requirements often, especially if you're traveling outside the United States. The CDC website has the latest and greatest travel guidelines for countries around the world. And speaking of travel, vacations and summer get-togethers offer a big incentive for vaccination. Think about it. If vaccinated, you don't have to quarantine if you're exposed to a positive COVID-19 case. For an unvaccinated person, an exposure could cause a cancellation or a delay in a trip or an event. Same thing goes for proms, graduations, and attending other special events. Not to mention the quarantine. You may end up getting sick with COVID-19 and have to isolate and potentially put others at risk. We're making progress on vaccinations with about 43% of Dubuque County residents now fully vaccinated. Vaccines are available from healthcare providers, pharmacies, and public clinics, and most sites do not require an appointment. Call the Sleeves Up phone number at 563-690-MAKE or 563-690-6253 to find out the current vaccination options. This week, there's still walk-in appointments available on Friday, 8 a.m. to 5 p.m. at the Kennedy Mall site in the old Yonkers store, along with this Saturday morning from 8 until noon at Crescent Community Health Center at 1690 Elm Street, and also at the Dubuque Farmers Market, the corner of Iowa and 12th Streets. Those are by our own Dubuque Fire Department. Pharmacies are also offering walk-in appointments. Call or check their websites. All vaccinations are free, and if you need help with details or want to know other options, call the Sleeves Up phone number. So we've learned a lot of new things this past year, many new terms: pandemic, messenger RNA, efficacy rate, days to double, epicurve, etc. A term popping up a lot lately is herd immunity. So I thought I'd give a quick tutorial on what herd immunity is. Herd immunity is really a concept based on a number of factors. First of all, herd immunity is different for different diseases. For example, for measles, which is highly infectious, you need at least 90% of the population to have immunity to reach herd immunity. For other diseases, the percentages may be less based on how easily the infectious disease is passed from one person to another. which is related to the next issue affecting herd immunity, and that is the R-naught factor, which you want to be less than 1. I explained this term quite a few months ago, but to refresh your memory, the R-naught is basically how many people are getting infected from each infected person. So to reach herd immunity, we want the R-naught to be less than 1, meaning the number of new cases drops with each successive individual. Finally, herd immunity relies on geographic and demographic distribution of immunity, either through natural or vaccine-produced immunity. What this means is that immune folks must be evenly dispersed throughout a community or area, both by location and by various groups of people, either by age, racial or ethnic groups, or those in different socioeconomic groups. Get the idea? For COVID-19, there's not an agreed upon level of immunity yet for herd immunity, but it's looking more and more like the percentage of immune people within a county or an area needs to be high, even as high as 90% or more. Stay tuned on this one. You may be getting ready for Mother's Day coming up on Sunday. A great Mother's Day gift is to get vaccinated, and encourage your mom and family members to get vaccinated if they haven't already done so. It sure makes gathering for occasions like Mother's Day easier, like no mask wearing and being able to hug your mom if you're both fully vaccinated. If your mom is no longer with you or only with you in spirit, adopt another mom or friend and inspire them to get vaccinated. Thanks for doing your part, everyone. And if you've made up your mind not to get vaccinated, remember, you have a responsibility to keep your distance, wear a mask when out in public, and quarantine if you're exposed to COVID-19, along with isolating if you have any COVID-19 symptoms. And finally, today is a special day, National Nurses Day. To all my fellow nurses out there, thank you for your selfless service during these difficult times. And I'm thankful for all the healthcare workers, especially now, that not only help us get well when we're ill, but work to keep us healthy. So let's all together do our part to stay safe and healthy. Happy Nurses Day again.